Hi everyone!
So I'm sure you guys have been hearing a lot about a virus called coronavirus and that we should stay home.
On behalf of me and my family, thank you to all of the brave first responders who are on the front lines, helping people in communities all around America. We're donating $500,000 to the First Responders Children's Foundation, which provides supports to the families of paramedics, police officers, firefighters, and medical professionals.
All of us at Ryan's World encourage you to help where you can by checking in on loved ones and being kind to everyone, especially during this time. This new coronavirus has been spreading all around the world with super tiny germs. They're so tiny that you can't see them, but can make some of us get very sick.
It's called coronavirus because corona means crown. The virus looks like it has crown-like spike all over the surface. So today, I'm excited because I get to interview a trusted healthcare expert named Andy Slavitt. He has done so many things to help the healthcare system for American families. We will ask him many questions about what we can do to prevent the virus from spreading. Okay, I think Andy's online now.
Hi guys.
Hi, Andy. Thank you so much for taking your time out to tell me and other kids like me what coronavirus is and how we can prevent it from going even further.
Yeah, we got a lot of questions for you.
Great. Let's start.
So first, to start off, can you help me with what we should call it? Should it be called coronavirus, COVID-19, or SARS-CoV-2?
That's so many different names.
That's a great question. That's such a smart question. I like calling it the shortest thing possible. So I like calling it COVID-19. But let me explain the difference. Coronavirus is like there's a whole bunch of different coronaviruses. COVID-19 is just one type of coronavirus. So it's both of them are accurate, but saying COVID-19 is more precise.
So the next question is, how do you know if you or someone else might have the coronavirus?
So this is the really, really, really tricky part about the virus. Is most kids, 90% of kids who have it, never know they had it. They never know they have it. That's right. And about 50% of some grown-ups never know they had it. So that sounds cool, but it's kind of tricky, and here's why. Because even though you don't know you had it, that doesn't mean you can't spread it to other people. So the reason why we're socially isolating so much is because it's so hard for us to know who has it and who doesn't. And so you could, by mistake, have someone who's playing with one of their friends. They might have it, but never know it. They might get their friend sick, and then maybe their friend goes to their grandmother's house. And their grandmother, if she got it, she would know, and she might get very sick. So the reason that we're having to stay inside and hang out with your parents and do other kinds of stuff is because it's so hard to know who has a coronavirus and who doesn't.
That's why we need to be careful.
Yeah. What are some tips that we can do to protect ourselves from getting the coronavirus?
These are such great questions. So let's start with this. Wash your hands a lot. A lot. Because that way you will never, if you are somewhere, you touch a surface, maybe the virus lives somewhere. If you wash your hands, that's a really good thing. Number 2, if you have to cough or sneeze, should you cough into the air? Like, should you cough at your dad or your mom? No way. Just go like this. Cough or sneeze right here. That doesn't spread, right? Just like that. Third thing, and this is the hardest thing for me. So hard for me. Don't touch your face. So I am the kind of person that likes to touch my face. So I find myself very hard not to do that. But the way that the virus spreads is it would get into your mouth, it gets into your nose, or it could get into your eyes. And so if you do all three of those things, and then a fourth thing, which you've heard about, this sort of 6-foot rule, is you try to stay a pretty good distance away from other people in case they sneeze or they cough and they forgot to do that. If you do those things, those are really some of the best things you can do.
Well, that actually reminds me of another question. If somebody sneezes or coughs and they have the coronavirus, how far can it spread?
That's such a cool question. So I heard about this thing where they injected some material that was like a black neon light, and they saw someone sneeze, because these particles are so tiny that they even happen when we talk. They come out of our mouth when we talk. I know that sounds really gross. It happens when we talk, and it certainly happens when we sneeze or cough. There are usually it's 5 or 6 feet, but sometimes when someone has a really big sneeze, either your parents have a really big sneeze sometimes.
Me. Yes.
So they've had, if someone had a really big sneeze, they've seen that it could go as far as 10, 12, 14 feet if your mom is really good at it. But that's sometimes that, you have to really try to get it out that far. And so there may be only a couple of particles out that far. So you don't have to stay 14 feet away from people, especially because you got to hug your mom a lot. That's important.
Well, why is washing hands important, and how much does it help us from getting the coronavirus?
It helps a lot. It helps a lot because another sneaky thing about the coronavirus, or COVID-19, since we decided to call it that, is it can stay on a surface, particularly a hard surface. Like if you've got a hard floor, or I see your refrigerator back there, or your counter, if someone has coronavirus or COVID-19 and they touch the surface, it can stay on there for a little while. And so if you came by and you touched it with your hands, but remember, they might not know they had coronavirus, and then you said, you know what, I know I'm supposed to wash my hands, but I'm not going to do that. And they said, you know what, I know I'm not supposed to wash my face, touch my face, but I'm going to rub my hands all over my face. That would be, first of all, that'd be super silly, right? But that's why they say, because you forget, because you don't necessarily always remember, every once in a while, you just go wash your hands for 20 seconds, you sing a song that you like, and then you get done, use soap, and there you go.
So, do we have to worry about our pets getting infected?
What kind of pets do you have?
Chicks.
That's cute. They're cute. I don't really know the answer about chicks. I do know I've never heard of a chick getting COVID-19, and even dogs. We have a dog. A dog can technically get COVID-19, but it would never know, and it can't give it back to a human. So there's cases where they found where dogs have had COVID-19, but dogs are really bad hosts for the virus.
Because a lot of people also have cats. What about cats?
I've not heard about cats, but I would bet it's the same thing as with the dog.
Oh, okay. So only from human to human.
Human to humans. If you had a bat, you have any bat?
Right. No. Good thing we don't have them here.
Right? Yeah.
Well, at least our pets are safe.
Yeah.
Yeah. And you'll be safe too. You just have to listen to your parents.
Yeah.
Yeah, you're a good listener. So we always have to wash hands. You have to remember that. Yeah.
But is it okay to go outside, but to our backyard or maybe even front yard to play?
So it is okay to go outside if you're not playing with other kids right now. But it's great to get fresh air sometimes. I don't know. Do you live in a big city? Do you live in a place where you've got a backyard and a front yard? If you've got a backyard or a front yard, you can absolutely sit outside, hang out, do what you do in the backyard. even okay to go for a walk around the neighborhood. But again, if you see another family coming or you see some friends coming, you just gotta wave from 6 or 8 feet away from the other side of the street, as opposed to running over there.
Right.
Is there any specific climate that COVID-19 is with higher chance of spreading around? Like maybe cold weather is better versus warm weather.
Yeah, viruses tend to like colder weather better. So the spread tends to go. Usually, it tends to go down in the summer. We don't know if it will here, but in warmer climates, it tends to go down a little bit.
Is there any good food I can eat to build up my immune system?
Pizza.
Really?
You like pizza?
He
Yeah.
loves pizza.
Hold on, Ryan, make a muscle for me. All right, let me see. Bring it closer. Okay, I think you got a pretty good immune system. I could tell from your muscles. Yeah, I think mom and dad know all the healthy foods to eat. I would just keep eating the healthy foods. I like pizza. I don't know, pizza doesn't really help with your immune system.
Wish it does.
You wish it does? Aw.
I know
Has tomatoes in it.
Wait, tell your parents to cover their ears. What's your favorite food?
I guess pizza or French fries.
Pizza. Okay, you can uncover them. We decided that pizza and French fries are good for your immune system.
Is it possible to make our own mask at home? Is it something that we can make with the stuff that we have at home?
Oh yeah. Well, it helps to have a sewing machine. But yeah, my wife made like 8 or 9 masks. Have you heard about YouTube?
Yeah.
I heard about it.
Yeah. So you go on YouTube, there's all kinds of people making masks. There's all kinds of places on the internet where they show how to do it. Usually it's 2 layers and then you put a filter or a paper towel or something in between. A lot of people make homemade masks.
Is there any effective material to protect you?
Yep, they've tested different materials, and I think a great thing to do is to go on to YouTube and look at different people who made masks, and you can see you don't need to use the same kind of mask that they use in the hospital. The doctors use. We need to save those right now for the doctors and the nurses. Those are the most effective ones, but those are for people that are around people who have COVID-19 all day long. And so you really don't need that kind of mask.
Then that means it'll be helpful if we make our own, right?
Yeah.
Maybe when we have a free time, we should do that.
Yeah. Well, those are all my questions, Andy. So thanks for telling us all about COVID-19, and I learned a lot about it. So hopefully my fans appreciate all the information.
I bet they will. I really loved meeting you and your parents.
Thank you so much again. We really appreciate this.
Thank you so much. It was nice meeting you.
Nice meeting you.
Bye.
I hope you guys learned a lot about COVID-19 like I did from Andy. Right now, the best thing for all of us to do is stay at home if we can and wash our hands often. I like to sing happy birthday 2 times while washing my hands.
For essential workers who can't stay home, thank you so much for your services. The best thing that we can do to help them is stay at home.
I'm also doing online schooling from home. Also, there are many fun activities to do around the house, like reading a book, doing arts and crafts, playing board games, and helping your family around the house, and so much more. Thanks again, Andy, for coming on my YouTube channel to explain about COVID-19. I hope everyone stays safe and healthy. And remember, always stay happy and rise up. Bye! And wash your hands.
20 seconds.
Yeah.
Keep going.